The United States records its first coronavirus death. Cases are exploding all over the world, and this is pretty much your last day to prepare. Hello, everyone. This is Chris Martinson with your Honey Badger virus update. It's February 29th, leap year 2020. I can't believe it's only 2 months into 2020. It feels like 2 decades. Before we begin, a little housekeeping. I may or may not be doing a video update tomorrow. If a lot of cases erupt, I think I will, but otherwise I really need a day off here. I also need to cover something, which is you might need to remember to resubscribe to this channel if necessary. I got a lot of messages like this. Hello, Chris Martinson. Today I woke up realizing YouTube has unsubscribed me from your channel and has even removed the bell notifications out of the blue. I don't understand what the hell, right? Paul said, seems to have happened to me. Wouldn't have realized if not for this tweet, because I sent this around. A lot of people responded. Vonnie here said, I can't believe it. And Kaylin said, I'm still subscribed. So a lot of people said they are still subscribed, so it's not everybody. So you got to check. This guy checked, had to resubscribe. Wow. Same happened to me, but fortunately I've been staying tuned. YouTube unsubscribed me too. This is just sort of the resistance that we're facing in trying to get this information out to you. And again, all I'm doing here is helping people get prepared for something that was completely obviously coming. And of course, the keepers of YouTube, Google, Twitter, other places have been really working to inhibit these sorts of messages. I don't know why. It just doesn't make a lot of sense to me. This is just logic, and I'm just connecting a few dots and presenting things that you can find out in the news and things that even major newspapers report on, but they don't get this kind of resistance from Google. So it must be just that, little people, individuals are not allowed to participate, I guess. I don't know. China, we don't know. They got some numbers here. South Korea, look at them, over 3,000 cases now, 800 new cases. They're doing really aggressive testing. South Korea is so far, I think, one of the gold standards, if not the gold standard for how to contain something. And look at the trouble they're having containing this right now. 3,109 active cases, very few total recovered. I'm still not clear on why they only have 10 in serious or critical condition, because compare that to Italy. Now over 1,000 cases in Italy, another 239 up here today, 29 deaths, already eclipsing South Korea, who has nearly 3 times as many cases, and serious critical, 105, 10 times as many as South Korea. I don't understand the difference between these numbers yet. Is it ethnicity? Is it a different strain? Is it reporting? I don't know. Iran is reporting more and more cases. I think this is a super low ball. And of course, they don't have any data over here about serious or critical people. So that's not really helpful. I don't know what's happening in Iran. I'm pretty sure it's bad. Japan now at 241, another 8 cases. They've declared a variety of emergencies around that. Singapore, 4 more cases, cracked over 100. In France, vaulting right up to 100 here, and another 43 cases. France has got a big problem on its hand right now, I believe, as does Spain coming on strong. Germany still coming in strong. And Thailand, who knows about that? Showed you that stuff yesterday. But even Taiwan doing a great job. They have +5. Look at all these things showing up here right now. And of course, the thing to talk about too is this first death. Not that one death in the United States really means all that much compared to the rest of these deaths in the larger scheme of it. But with the United States now joining this, I think there's larger financial and economic impacts that come from that, because this is the world's largest economy and most financially active system. So about these new cases, the death was in Washington State. We'll talk about that a little bit more. We don't have a lot of data around that yet. This is being recorded at a time right before there was going to be a public announcement about that. So we'll have benefit of that later. Luxembourg, first case. France, 27 new cases, getting to that magic total of 100, if that's a magic number. Ecuador, first case. UK, 3 new cases, raising the total to 23. And I'm going to tell you why I think that's a really big deal in just a second. But first, we're going to go here to the first U.S. death. Department of Health confirms first coronavirus death in Washington State. President Donald Trump said in a press briefing, a coronavirus patient died overnight. He described the patient as a medically high-risk patient in her late 50s. She was a wonderful woman. Just recently, the CDC came out and said the coronavirus patient who died in Washington State was a man in his 50s. So I'm sure he was a wonderful man. More concerning, as concerning, but more concerning. I don't know how to put this. It's there's just so much going on. I don't know what words to use anymore. 2 new cases of coronavirus are reported in the Seattle area Friday evening, according to officials with the Washington State Department of Health. The first is a teen with no travel history who attends Jackson High School in Mill Creek. The teen is at home in isolation, but visited Seattle's Children's North Clinic on Monday, so I assume that's Monday of last week. There's a concern that he acquired the virus in the community. Well, where else would he have gotten it from? I think that's a legit concern. Health officials said, and they are working to identify how the teen was exposed and trying to track down people who might have come in contact with the patient. The second person, a King County woman in her 50s who traveled to Daegu, South Korea, so probably got it there, and is at home in isolation. Doesn't need medical attention, recovering without complications. Okay, so that's all fine, but it looks like we have community-level transmission going on in the state of Washington. And I think this means that, remember those non-pharmaceutical interventions, NPIs. That's when you can't treat these things anymore in a pharmaceutical or medical setting. You have to go for isolation. You have to go for social distancing and banning large gatherings and things like that. Washington state officials say they are not going to be testing all cases. Why not? Well, anyway, we'll get to South Korea, and I think you'll see why that's so important. They will need to triage the most high risk and the most severe coronavirus patients. So this means we don't really have the resources in place. If you have to triage already and you only have a handful of cases, I mean, if you're in triage and all you know about are 2 cases here and somebody who's just died, it's just a handful, but already triaging because I guess the necessary test equipment or skills or something isn't available. And that's concerning because that shows a pretty thin system at this point in time. The public is going to need to accept this and realize they will need to prepare and accept various NPI measures, meaning we're not going to test you. We can't contain this anymore, so we're going to just try and mitigate it. So we'll just put walls around things and keep people isolated from each other. That's what you do when you sort of throw your hands up and say, we can no longer contain this. But let's hold off on whether that's possible or not until we look at what South Korea is doing. Before we get there, this in The Guardian, I just shook my head when this came up. I don't even know what to make of this. England only has 15 beds available. England, 15 beds for the worst respiratory cases. This is from the 27th of February. That's 2 days ago. England only has 15 available beds for adults to treat the most severe respiratory failure and will struggle to cope if there are more than 28 patients who need them. If the number of coronavirus cases rises, not if, it's going to be when. That's just how this seems to be working. Ministers have revealed in parliamentary answers that there are 15 available beds for adult extracorporeal membrane oxygenation, ECMO treatment, at 5 centers across England. The government said this could be increased in an emergency. There were 30 such beds in total available during the 2018-19 winter flu season. So that was last year, year before. But an NHS England document prepared in November 2017 reveals the system will struggle to cope if more than 28 patients need the treatment. Describing that situation is black/critical. Just 28 patients. Obviously, when you go back and you look at what other countries are dealing with, how many countries have more than 28 patients in serious or critical? The Diamond Princess alone was able to cough up more than that. Italy facing, 4 times more than the critical black level in England. So England is just not ready at all. So the UK, you would think, given this sort of information, you would be out there with absolutely the most aggressive contact tracing. You would have banned travel. You would have been really looking very, very carefully at people coming from other places like Italy, like South Korea, but you'd be wrong. Those sorts of measures really didn't happen, and I'm confused as to why that is. Lots of new reactions to this. Here's just a few. The U.S. will deny entry to any foreigner who's been in Iran in the prior 14 days. Okay. Again, that could be 27 days for people like us who understand that the asymptomatic period is up to 27 days. A French health minister says all gatherings with more than 5,000 people in a confined space are banned due to coronavirus. That's just confined space. So I don't know. I guess it'd be fine to have a parade. I don't know. Switzerland yesterday announced 1,000. These are large numbers. Why 5,000? Why 1,000? Should it be 100? Really, they're just picking numbers. The French government, so they're just throwing up their hands here, says virus is circulating. No point in quarantining people coming from hot zones. No point. No point. There might be a point if you're saying what we want to do is shift the bell curve to the right of cases so that our hospital system doesn't get swamped, so that our 28 beds, if you're the UK, get filled up, and then the 29th and 30th patients and so forth are out in the hallway or in totally inadequate rooms having a really hard time of it. This virus, the honey badger virus, is really off the charts in terms of just how tricky it is and how persistent it is. Look at this information. In Daegu, 1,900 Shincheonji church members have been tested for coronavirus. 1,300 had symptoms, 600 did not. Among those 1,300 with symptoms, 87.5% were confirmed with the virus. But out of the 600 without symptoms, 70% were confirmed with the coronavirus. This is why you need that aggressive contact tracing, because you can have people who are carrying this thing who are asymptomatic. I'm going to presume a lot of these are going to become symptomatic. I would like to know that. I would like to know how many people carry it who are totally asymptomatic throughout the entire thing. There's some, but we don't know how many. But this just goes to show you that this is why you need to do all this testing. You know how many of these people without symptoms would have been tested in the United States? 0. How about in the UK? 0. How about in most of Europe? 0, right? So these wouldn't have been tested. You wouldn't have known until they got out there. 600, good grief. So we're still fighting ignorance. We, in this case, it's this other person here. This is a gentleman who's had a lot of experience with this. I thought this was instructive. So this just came out February 28th. It's the 29th today. And this is writing to the Minister of Health in Belgium, right? The Minister of Health. This person writes in an op-ed, "You assure the country that we are ready to face the new coronavirus. And yet certain key frontline players, nurses and doctors, are not reassured. Neither am I. I'm a doctor of science. I led a group of researchers in the United States studying human coronaviruses in general, and the one responsible for the SARS epidemic, SARS-CoV in particular. A lot of experience on this, gentlemen. I did this work in 2 institutions as a member of the faculty of the College of Medicine, University of Cincinnati, and as an investigator with the only institute in the world devoted exclusively to research on respiratory diseases in Albuquerque, where I had the opportunity to study all aspects of aerosol production and aerosol transmission." Whew, yeah, a lot of experience in this person. Probably should listen here. "In these 2 institutions, I was one of the officers responsible for ensuring that all experiments involving infectious or recombinant agents respect all rules, do not pose a danger to the general public. I've already sent you a file via the SPF Health website on February 12th. Well, that's 16 days ago, which indicates that if the proportion of symptomatic cases due to the new coronavirus reaches 1% of the population, we would be on the verge of a hospital crisis due to lack of beds. It went unanswered, and that's why I'm writing to you directly." Let's continue with this. "In an interview published on Wednesday 26, you answer the question, but how many beds do we have exactly? You know that in Belgium, we have enough beds and sufficient treatment capacity." The health minister responded, "This is an advantage. When you compare with winter flu and the number of elderly patients who are generally hospitalized, the situation is the same." So here's a health minister 3 days ago saying, when you compare this coronavirus with winter flu, it's kind of the same. In my file, I quoted the WHO, which on February 10th estimated that approximately 16% of symptomatic patients were in a condition serious enough to require hospitalization. We reported that even before February 10th, that particular data. Influenza, approximately 0.2% of the cases, 16% compared to 0.2. The relationship, a factor of 80. It is therefore not an identical situation. The first essential point, which is overlooked. The WHO fact-finding mission to China released its report yesterday, and it's worth consulting. We now have more precise figures for symptomatic patients. 80% of mild cases that can stay at home, 13% severe cases, and 6% critical cases requiring intensive care. So those are the numbers that I think we're beginning to hone in on. Those feel about right, although I got to confess the Italian numbers are running hotter than that, and as well the data, such as it is coming out of Iran, looks worse than that. This person continues, and again, here's the link for this whole thing. Sorry if you wanted to jot that down. That's kind of long, but you could probably just pull some text here and find it by Googling. Real easy. The basic reproduction number of the new coronavirus is between 4.7 and 7, according to the calculations of different epidemiologists. So this is different from the reproduction number calculated by the WHO at 2.5. Wrong number. WHO's got this one really badly wrong. And of course, seeing how easily it's spreading should tell you that as much. Take the situation in Italy. The first 2 cases are confirmed in Milan on January 31st. And we are 285 days later in... I don't understand what that means. I think this is a translation error. January 31st. We're only 28 days later. Yeah, that would have been 28 days later. I don't know what that 5 is. Maybe it's 0.5 got missed. 28 days later, 655 cases. The epidemiology tells us to take the logarithm base 2 of 655, divided into 2 initial cases, namely 8.3. Therefore, the number of cases doubled every 3.3 days, almost doubling all 2.4 days in the absence of insulation. That means contact isolation. And while insulation measures have been in place for a few days, so these figures are consistent with really high reproductions, 4.7 and 7. You can't compare this to the flu. It's not even close. What would you do if you had a health minister who was still saying this stuff? When you compare with winter flu and the number of elderly patients who are generally hospitalized, situations, it's the same, That level of ignorance is astonishing. So I said I was going to show you in South Korea, this is how it's done. This is how it's done. Great summary here from this person. We are living in tough times right now in Korea. The kids and I have pretty much stayed home this week, and next week won't be much different. As I told you, when you get into quarantine and self-imposed isolation, it's just boring. So you make sure you got plenty of books and games and hobbies and things to do. That's part of our advice here. Okay. But I've got to say, the government here has been nothing but transparent, and that's why the reported numbers are so high. They've tested nearly 80,000 people, and Washington State's triaging with a handful. We're out of test kits, or I don't know what their story is. 80,000 people, many of the results pending still. However, when a new case is identified, an emergency message is sent to everyone, letting them know where. Remember I showed you that? They send these text messages out. Local agencies have also been translating info into English, just in case. Next, a timeline is given of the person's whereabouts from the past 48 to 72 hours, so that if you've been in these places, you can come by and get tested. These places are immediately shut down and sterilized. Although, at times, this whole situation is daunting, as many countries are and have banned Korea from travel. I am impressed by how it's being handled here and have faith that we will recover from this. I'd rather have full transparency than walk around with a false sense of security any day. Hey, me too. Absolutely me too. That's how it's done right there. Fantastic. In the United States, I think it's a little bit too late to prepare, mostly, depending on where you live. Look on CNN. By the time you get here, we are at the self-evident stage of this right now. So right now, we've come to the conclusion that this virus is not going to be contained. So that means every country, every location really needs to prepare, says infectious disease specialist Dr. Amesh Adalja. Okay. All right. So that's conclusion 1. And what does that mean? Well, that means you start seeing stuff like this. Costco this morning out of toilet paper by 10 a.m. and most almost out of water. Interesting to see how the supply chains react. Also, this guy overestimated the capacity of his minivan, especially with the seats up. Wow. Yeah. Good luck with the shocks on the back of that, buddy. Too late to prepare, mostly, sort of depends. Here are people in Hawaii. They are lining up outside of Costco to buy supplies after the Hawaii Department of Health on Wednesday advised residents they should stock up on a 14-day supply of food, water, and other necessities for the potential risks of the honey badger virus. This is from February 28th. So soon as you see that, game on. The jig is up. People get the vibe, and next thing you know, you get that little panicky vibe that happens where people realize how unprepared they are and all of that. So that's why we've been advising people to prepare early, prepare often, because as soon as this happens, it's too late. There's not a lot you can do. And if you are in a crowd like this, resist every effort you can to hoard, grab too much. I mean, this to me is not where you want to be. That's not even remotely correct, right, or even social behavior as far as I'm concerned. So welcome to stage 3. All truth passes through 3 stages. First, it's ridiculed. Second, it's violently opposed. Third, it's accepted as being self-evident. Well, that's where we are. Remember I was ridiculed? I had Bloomberg articles that were ridiculing this stuff I was putting out. Mother Jones. Shame on Mother Jones, by the way. That was awful. They're supposed to be about independent citizen journalism. Is how they got their start. At any rate, LA Times, for weeks, federal officials told states that only the CDC and a few other labs could test patients for the coronavirus. Now officials say California labs and 36 other public labs across the country will be able to start testing. What? I don't even understand. How is this even a thing? How is this even a thing that the federal government was saying, no, you can't test, you can't do it, and on what basis? You're going to run a bad test? Nobody can explain this. There is no good explanation. Sorry, there just isn't. Florida state labs can now test for coronavirus, cutting wait times for results. Of course, that's all perfect, because if you want to do what South Korea has been doing, where you're testing thousands and tens of thousands of people, well, I think the fear has always been that if you do that, you end up with numbers that look like this, right? And that's what happens when you start testing, is you find lots of people with it. And gosh, people would rather be ignorant and not know. I don't know. I really don't understand. At any rate, I think that's the excuse here, is that the idea was if you don't test, you can't. You won't find that you have a disease. I mean, how can you have a disease if you don't test for it? I guess that's the thinking. I don't know. Anyway, the honey badger virus, Cat5, it's a Cat5 virus up here, right? It's got that case fatality ratio is going to be well north of 2%, especially if you get overwhelmed. And remember, there's only hard decisions left, because once you're at the stage of the pandemic we've got now, you either need to, one of these 3 things, you get to pick one, right? You're either going to try and stop the contagion. So to do that, you keep people isolated and contained to prevent the spread. Get that R0 below 1. Very hard to do if the R0's 4.7 to 7. So you got to do what China did. Lock people in their houses, or, either literally or have them do it on their own. And just really, really very, very strongly and draconianly limit the interactions of humans with each other. 2, gosh, you kind of need to keep the economy going. People need to eat and all that stuff, at least enough to feed everyone. So you got to do that. But if you do this right here, you might sacrifice this over here. All right. And then if you are going to go over here, you also got to make sure that, okay, we're going to put up with a little bit of infection. We're going to let it burn through. There's nothing we can do about it. Hey, we're just down to mitigation, no containment. We give up. But you can't let it burn at a fast enough rate that it swamps your hospitals, because that's very bad. And in the UK, if the swamp number is 28, you don't have a lot of leeway in there. So it means you're going to be doing a lot of this. Phrased another way, your choices positively are between stopping the contagion, keeping the economy going, and keeping your hospital systems working. Phrased negatively, your choices are we going to have a pandemic? Are we going to crash the economy? Are we going to kill a lot of people or sacrifice them? There are not any good decisions left. And of course, if we'd gotten on this earlier, the decisions would be better. And of course, as we've been saying all along, the honey badger virus, this thing is not the flu. It's not SARS. It has a very high serious complication rate, 15% or so. We've had these numbers up for weeks and weeks. We're glad to see other people coming around to that now. But gosh, we could have had these numbers weeks and weeks ago. Because we did. Wasn't that hard to come up with. Up to 5% requiring intensive care treatment. If you do get into complex intensive care stuff, it's very complicated, very complex. A lot deadlier than the flu. The super high R0, we said maybe as high as 6.7. I guess we got to say that's 7 now. this thing spreading asymptomatically. That's just really bad. So hard to contain that. Spreads via droplets and aerosols. That's the worst part about this. And of course, in that case in Northern California, where they only had the person who they suspected of having a viral pneumonia, they had them under droplet protection. Turns out they needed to have them under aerosol protection. The CDC dragged their feet from all the way from Wednesday to Sunday before they tested the person. And now we have over 100 healthcare workers in self-isolation, taken off the front lines, no longer helping because they got exposed to an aerosol. Very bad. Super long incubation period, no natural immunity in the herds, no fire breaks, no vaccine available, no prior vaccines to work from, and the prior SARS vaccines were worse than nothing. So get ready for a lot of these early, hey, there's a vaccine on the way stories to quietly disappear into the ignominy of a bad clinical safety outcome. Could happen. We don't know if smoking makes it worse or not. Men seem to be hit harder. So do men smoke more than women? We don't know. That has to be resolved later. The second exposure, is that going to be worse? This antibody-dependent ADE pathway that's identified in MERS enormously complicates vaccine development, and testing often results in false negatives. And of course, sometimes you have people who are asymptomatic and actually have a positive. So what do you do with that stuff? Kids are spared. Thank the Lord for that. And pathologically, it doesn't look like SARS. So all sorts of reasons. It's not the flu and it's not SARS. So the conclusions for today, the summary here, we're now at the self-evident stage. We're at stage 3. What was ridiculed last week, now it's accepted. Now we just got to manage this thing and do the best we can. The time to responsibly prepare is all but passed. Maybe where you live, you got another day or two, but not a lot. This is pretty much that horse is out of the barn. Containment was never really even tried in the U.S., in UK or Europe, and so testing was part of that, because testing's easy. Obviously, it can be done. Other countries are doing tens of thousands of them, so it can be done, but not when you're not trying. And mitigation now is the strategy. Get ready for those NPIs. Get ready to be out of work. Get ready for the kids to be home from school. Get ready to not go to big gatherings. Get ready to not have concerts or go out to packed bars. All of that. That's part of it now. Hospital systems, in some places, they are going to be overwhelmed. I have lots of private emails from people in hospital systems telling me that their systems are already running at or close to 100% of capacity right now, and that's just because of how they normally operate, coupled to a bad flu season. So put another 10, 20, 30% on top of that, and they become a little bit overwhelmed. Put 500% on top of that, and they're just completely smashed. Here's my final conclusion. You know what? It didn't have to be this way. It really didn't. We could have used logic. We could have had competent people daring to put their careers on the line to make the right calls and do all of that. It didn't have to be this way, but here we are, so we're going to make the best of it. And thank you so much for listening. That's all I've got for today. We'll be back at you as soon as we can, maybe tomorrow, but for sure the day after. Thanks for listening.
Hi folks, Adam Taggart here. Chris Martinson and I are the co-founders of Peak Prosperity. If you want to get alerted whenever we release a new video from Chris, just click the red subscribe button right beneath the YouTube video player. Once you've done that, a little bell icon will appear right next to it. Click on that bell. It looks like this. And that's it. The next time we publish a video from Chris, you'll immediately receive a notification from YouTube. Thanks for watching our videos.